What is an endoscopy biopsy for ulcer diagnosis? Imagine being able to look inside your stomach and small intestine without surgery. That's what an endoscopy allows. During this procedure, a doctor uses a thin, flexible tube called an endoscope, which has a tiny camera and instruments attached. The doctor gently inserts the endoscope through your mouth, down your throat, and into your stomach and the beginning of your small intestine. This lets them see the lining of these areas directly. If they spot an ulcer, they can take small tissue samples, called biopsies, from the ulcer edge or nearby tissue. These tiny samples are then sent to a lab for detailed analysis. The main goal of this biopsy is to find out what is causing the ulcer. The lab examines the tissue under a microscope to look for signs of damage, infection, or even cancer. One common cause of ulcers is a bacterial infection called Helicobacter pylori. The biopsy can be tested for this bacteria using special tests like rapid urease tests or cultures, detecting H. pylori is important because it guides treatment, often involving antibiotics and medications to reduce stomach acid. Sometimes, the biopsy helps rule out other serious conditions like stomach cancer, which can sometimes look similar to ulcers. Before the procedure, your doctor might ask you to stop certain medications, such as proton pump inhibitors or antibiotics, because these can interfere with the test results. The endoscopy biopsy is usually done after initial evaluations, especially if symptoms like persistent stomach pain, nausea, or indigestion continue despite treatment. The procedure is minimally invasive, meaning it doesn't require surgery, and it typically takes about 15 to 30 minutes. The tissue samples are examined carefully in the lab. The pathologist looks for tissue damage, signs of infection, or abnormal cells. Sometimes, the samples are also tested for other infections or conditions. This process helps doctors make a precise diagnosis, so they can recommend the most effective treatment plan. Overall, an endoscopy biopsy is a vital tool in managing peptic ulcer disease, helping to confirm the cause, rule out more serious issues, and guide targeted therapy. If you have symptoms of an ulcer, talking with your healthcare provider about whether this procedure is right for you is always the best step.